In this video, we're going to be talking about this, not an upside down spine, but the inversion table, specifically the Teeter table. Now, we've got it delivered, we got it just into the clinic today. I'm going to be going through how this can help you with your lower back pain, whether it's caused by bulging discs, giving you sciatica, those sorts of things, and how you can use it effectively. But first, we don't want to be building the Teeter table in this sort of attire. We want to change into something that's comfortable, something that we can move in effectively so that we don't injure our back and need the table halfway through building the thing. So let's go and get the Teeter table built. Hey guys, so I've changed it into something a little bit more appropriate. I would urge you not to be wearing jeans, suit trousers, or anything like that when you're doing this. Wear something flexible, something that you can move in and don't have a belt around the midsection. That's just gonna make your back worse while you're building this thing. So have something flexible. Let's get in and we're gonna go and build the Teeter table and come back and start talking a little bit more about the specifics later on. It took us around about 20 minutes to assemble the table. Everything you need comes in the box, so that's really good. It really wasn't too difficult at all. And then we spent really the next week or so just getting to grips with the table and filming the content for the rest of this video. So hopefully you guys are going to enjoy. Hey guys, so this is an inversion table. We're going to be reviewing this one today. It's a tool that people use for back pain, and it's very similar or an at-home version of the IDD spinal decompression that we do here in the clinic with our equipment. Now, we're going to cast a critical eye over the table itself, getting on, getting off, how you can use it, pros, cons, quirks, everything. We're also going to talk, for those of you that have tables like this at home, about some pivotal ways that you can use this to help your back pain rehab, whether you've got back pain right now or trying to keep it at bay. So do stay tuned. This video is going to be packed full of content for absolutely everyone, whether you've got back pain right now or whether you've got this table as a maintenance tool. And do be sure to stay to the end of the video because we will be giving away one of these tables and we'll tell you how to enter that competition at the back end of today's video. With that being said, let's get straight into it. Hey guys, so first things first, you'll notice I've changed. If we're going to be using these sorts of treatment things at home, then please wear something comfortable. Don't wear a suit or jeans or a belt or anything like that. We want to allow this table to do its work. Now this is an at-home version of the spinal decompression that we have on our IDD table in the clinic. And yes, there's numerous ways in which it's not as good, but there are all these little tools at home that they're not the same as if you go to a clinic, but they can help you maintain things at home. Now you've got the towel at home that many of you guys in the back and shape will be using. This has got elements of that and a little bit more. So we want to compare it to the IDD table. Yes, it's doing the same thing. We're getting stretch, but it's not nearly as specific or as controlled, and obviously we're not doing it for the 15-20 minutes or longer that we do the IDD for. So just bear that in mind, and it's obviously not overshadowed or overseen by a practitioner. Now this is for anyone that's got disc issues, lower back issues, but you don't necessarily need to have those issues to do this. Personally, myself and Lara, we have treatment in the clinic. We do it from a maintenance point of view. There's nothing fundamentally wrong, but we believe in looking after ourselves, using it as an MOT, and it's better to prevent things than have to treat them. That being said, many of you guys have come to see this video because you've got back pain. You've maybe got disc injuries, you've got sciatica, those sorts of things. And we want to be careful when we're first using something like this, because if you do have more severe symptoms, like we see in the clinic here where people go on the IDD table, when you first take the pressure off that spine, it can really sometimes completely alleviate the symptoms. They just go, because the thing that was injured and it's got pressure on it with gravity every day just completely dispels. You want to be very careful because on this table, you can come back up and put that pressure back on very, very quickly. It's not as controlled as what we do in the clinic here. So please bear in mind. And with that, I'm going to kind of move on to tips for first time users. So maybe you've got one of these tables at home, maybe you haven't. If you're in a position where you've got back pain, which is what's motivated you to do this, including sciatica, or with or without sciatica, then we really want to make sure that we make use of this strap. Now, building the table at home is super, super easy. And you've probably already seen a sped up version of me building the table here in the clinic with Lara. So this strap is really, really important because you can set it using the different settings here to limit how far we go upside down. Now, the first time I went on this table, I kind of got in and you'll be able to figure this out. It's pretty easy. We've got the ankle strap here. We just kind of put that on here like so. And the first time I went on, you lean back and you just go, whoa, we're going upside down. Oh my gosh, I'm going too far. And then you fling back up like this and oh my God, my back is killing me. We don't want to do that, okay? So if we use the strap down here, we can limit it to 30 degrees of inversion. So you just go back and we only go to about here. Okay, I had it on 60 there and I'll explain why a little bit later on. So definitely if you're the first time, use it tentatively. Don't just jump on and do anything silly. It's really, really important. We don't want you guys to use this and hurt yourself. And the worst thing I think that you can experience is to quickly invert and then come back up very quickly. So get a bit of control. It is super easy to learn to use. It does take a bit of a quirk. But like with anything with treatment in the clinic or with exercises and maybe even the back and shape, sometimes when you do something first, it can be a little bit painful if we do it incorrectly. And you wouldn't want to get this table, use it. Or start an exercise, maybe it's the things one of back and shape. Put the towel too low, put pressure on your disc, and then recoil and say, I can't do any exercise, it's not for me. So when we're first on the table, if we just lean back slowly, maybe if we hold onto the handlebars and just help move it ourselves, we can get a bit of a feel for how responsive the table is or isn't. And then we can just use our arms to move the table around without going too far upside down. So just be slow and concerned or careful when we're going through that first bit. Also, if you are dizzy, if you're worried about going upside down, then be very, very careful. And if you are someone who really suffers with dizziness, then please, maybe this isn't the table for you, because you are going to have to be upside down to get some of the benefit. So that's really, really important. Now, if we move on to sort of the overlying review of the actual thing itself, one thing I really do like is this bit down here. Now, we know a few people personally and in the clinic here that have things like scoliosis, and that puts asymmetrical load through our spine, which is not good. And a lot of people, if you've got disc injuries, you may know that your symptoms are more on one side than the other, which generally we find maybe there's a little bit of a tilt through here. The nice thing about this, which other tables I've seen don't have, is we've got this little black support here, which actually is supposed to support the lordosis. But what it does is it kind of sits on your pelvis here, like so, and means that the pull is much straighter. So even if you are a bit wonky, as it pulls you, I really like that it actually pulls you straight, and it's going to unload these discs, which is really, I think, vital that we're doing that in a symmetrical manner. But if you are someone who has that sort of scoliosis or something like that, then as you go upside down and you come back up, you do just want to be careful, come back up slowly. That's really, really important. Now, if you want some extra tips, how can you use this table more effectively? Obviously, the reason we're talking about this table at all is because it is a way in which we can extend things that benefit you with regards to your back pain that maybe you haven't already thought of. A lot of people that are in the back and shape, they know the towel exercise is just an absolute lifesaver. It's something that unloads the spine. It's a great tool, and this is no different. But there are ways you can use a table that can make it a little bit more effective based on our experience. One of the nice things we do with the IDD therapy in the clinic here is we pump it at about 20-second pumps. So what that means is we go up to the max pull for us, and then we come down a little bit and do 20 seconds at each level. That is really, really good. So we can do that on this table. Lock yourself back in again, and we're in it secure. Make sure this is secure. And if you come back, I really like how with the Teeter table you can kind of just go upside down. So now we're at 60 degrees. Okay, and this, of course, this is for those of you that are a little bit more advanced. Okay, you've used it a couple of times. I didn't do this the first time I got on the table. I didn't go all the way upside down. So please don't jump on and go, oh, just leave that little strap I told you about. I'll leave that off. Please don't do that. So we go back and we go to maybe 60 degrees, so you can pop your hands upside down like so, and you will feel the stretch. That black thing I mentioned is holding my spine steady. It's allowing it to be a little bit more focused. The big weakness here is that we can't control where the decompression is coming through. It's just coming from the ankles all the way down. Whereas this little black lumbar support does help focus it a little bit more to the L5, S1 and L4, 5. But what we can do is we can go down to 60 and we can stay down here for around about 20 seconds. Then we can come back up to 30 and it comes off a little bit. Then we can go back down to 60. And obviously when you're doing this, you'd be doing it with your head relaxed, and then we can come back up to 30. And you can see how easy that is to do with my arms. All I'm doing is move my arms. And I'm obviously talking to you guys as I've got my head up, it makes it a bit more difficult. But when you're completely relaxed, you can pump it. And I would definitely suggest those little 20-second pumps, 20 seconds at a slightly higher angle, 20 seconds at a slightly lower. And when you come back up, especially if you've been doing this for maybe 2-3 minutes, come back up in stages, come back up to flat, and then come all the way up. That's going to work a lot better. And one thing to really draw your attention to is when we've just finished decompression, many of you have done the towel or some of the other back and shape exercises you'll know that we don't like you doing forward bending. We've just done something to unload those discs and take pressure off while we've been upside down. If I now go and bend over to do this, number one, you might really catch yourself out, and number two, it's just a waste of time. You've just wasted what you've done on the inversion table. So the nice thing about it is just bend your knees a little bit, and that way we can unlock it like so without having to bend our back too much. And then we can obviously dismount, get out of these things slowly. You've just had your spine stretched, we'll have a little bit more mobility. We don't want to be silly and cavalier about the way in which we get off the table, especially this is true or likely if you feel good after you've had it done. And that kind of brings me seamlessly to the next point, which is how do we use this in the context of sort of every day? For those of you that try and recover from back pain and you're using this as an aid or something like this as an aid, please be mindful. This is a relief-based exercise. What does relief-based exercise mean? It's the same as the towel. It's got some nuanced differences, which I'll get into a little bit later on how you combine this with things like the towel to be more effective, but it is a relief-based exercise. It's not doing anything for the underlying problem in so much as preventing the underlying problem reoccurring. What it's doing is helping with the healing side of things, but the reason that disc is injured in the first place, as many of you will be aware in the back and shape, is because of a number of other facets. You were sitting for too long, we're doing all these other bits and pieces. And if we just use something like this and we use it every day, you might find you can keep symptoms at bay, like people do with the phase 1 routine in back and shape. But unless you use this with a concerted strengthening program, we're not going to actually be able to make that step forwards and actually get ourselves back in shape properly. And why I say that is that a lot of you guys, when you've got these disc injuries down here, there's so much compression, it's jamming everything down. And that reduces the amount of movement, or with less movement, the muscles don't have to work necessarily as hard in some ways. Now we've got more movement, they have to stabilize more. Now one of the exercises that some people get from a rehab point of view is you might do squats. Then you might do squats on a wobble board. Well, why is the wobble board harder? The wobble board is harder because on that wobbly surface, with that extra mobility, the muscles have to work harder to stabilize. So if we're doing this religiously on the table here, and we're not doing strengthening, just like with the IDD table in the clinic, if we're not doing the strengthening work at home, this is going to have limited long-term effects because we're not doing the necessary work to rehabilitate ourselves and the structures that support this spine. So please, please, please be mindful of that one in particular because it is a really, really big point. Now, I think that's pretty much everything covered there. The last bit I wanted to talk about before we get into a few questions from some of the members was going to be how can you feed this into back in shape, because that's really what we want to be able to do with this particular table. The back in shape is something that we've developed here to complement the recovery process that we do in the clinic. We do the treatment, yes, and this would come under sort of relief-based, treatment-based category, but the rehab work is so important. And as I mentioned already numerous times, strengthening is very, very important. Now, I would never, ever, ever do this table right before I'm doing the workout. It's just not a good idea. It's a very, very bad idea, in fact. That being said, as I mentioned earlier in this video, Lara and I regularly come into the clinic and do some treatment on the IDD table, or vibration, or laser, or whatever it may be, because that's good, just general health practice, general maintenance practice. Our bodies, many of us will be sat down watching this video in the office, or sat down on the couch at home putting pressure. This can help unload the pressure. But it's always better, in my opinion, to do it after your workout. You might do your phase 2, you might do your phase 3, and then between doing the other exercises and the towel, jump on here. Just going to stretch things out a little bit, then you lie on the towel and it restores that natural curve. That, I think, is a really, really good way of doing this. The final thing to address, and then we will get on to questions, is full inversion. Now you notice I've got the strap on to stop this table going all the way upside down. If I unhook that there, which is very easy to do, the table will go completely upside down. One of the questions, and this is really the first question we're going to address, was what about the full inversion? And should I do some of the exercises that are demonstrated on the actual Teeter website? Now I do like the Teeter table, but I don't like full inversion. In the clinic, one of the ways in which we get better results out of patients is we adjust certain parameters with the IDD spinal decompression. We've done that since before we used the IDD table when we were using other spinal decompression devices. Full, strong, uncontrolled spinal decompression is not a good way of doing things. Being a little bit more gentle helps us work better, helps us be more effective. And tipping ourselves completely upside down, although many of you will find that temporarily quite pleasant, it's not the most effective way, in our experience, of doing things. A little bit more control and a little more gentle forces helps reduce the amount of muscle spasm that you get. Because as soon as you turn yourself upside down, your muscles are kind of going to tense up a little bit because it's just too much. You're not used to it. So please, please, please be mindful of that. And the final thing was doing things like inverted sit-ups, where your ankles are locked in here and we're doing sit-ups while you're hanging upside down. That's just a big no-no. I know those of you that are in the Back in Shape program don't need to be told that, let alone the twisting exercises that you can do. Because these handlebars, one of the reasons that they're here is so you can be upside down and stretch yourself. I just don't think that's a good idea. There's plenty of other things we can do, but doing that inverted, decompressed stretching and twisting, I think is just potential. Well, firstly, I think it's unnecessary. I think we can get great results without doing it. And I think the risk of it being done incorrectly or coming up a little bit twisted and catching ourselves out is just not worth the hassle. So that's pretty much it. As for the last few questions, we've already addressed the full inversion. How long? I've kind of alluded to that. It was about 5 minutes or so is what some chiropractors have mentioned, some osteopaths have mentioned, and some patients have said they've been stated. We do decompression in the clinic for 15, 20 minutes, sometimes 10 minutes, sometimes a little bit longer. It does vary patient by patient. I think 2 to 3 minutes that are sort of stated on the box, so to speak, is a little bit less than what you might be able to build up to over a period of time. But if it's your first go on, many of you guys will know about treat principle, which is test, rest, evaluate, and then adjust if necessary, and then test again. Don't jump on it for 20 minutes the first time. Do that a couple of minutes, a few inversions, see how you find it, or a few tilts, not full inversions, see how you find it, and then go from there. I don't really think there's a reason why you can't do it for a little bit longer. Overall, I think it's a pretty good thing. Dizziness, we already covered that. If you're someone that gets dizzy, really have a long, hard think as to whether this is for you, because they're not cheap. We didn't want to get a run-of-the-mill inversion table that was rubbish, poorly constructed, poorly manufactured to review, because that's a waste of time. The whole principle of our clinic is we have the best decompression equipment, we get the best vibration equipment, we get the best lasers you can get, we have the best analysis. Everything we want to do is to get the best results for your patients, and that extends to those of you guys that are in the Back in Shape and even watching this video right now. So we didn't want to get a cheap rubbish table. If you've got dizziness or have dizziness, then really think twice about doing this. And that is pretty much it from me. I hope you found this video helpful. I do know that the guys, where we got this table at Gym Kit UK, were going to try and get us a little discount code. If we've managed to do that for you guys, then there'll be a little code in the description of this video. So if you do find this interesting, then you can save a little bit of money there. I think it's like 5% saving. So hopefully you found this video really, really helpful. And if you do have any questions, as always with all our videos, please do post those in the comments below. We appreciate the video. And that is pretty much it. The next part of this video is going to be something to watch out for. Thanks for watching the video. Hopefully you found it full of useful information and really, really interesting. A lot of people don't know about these tables, and maybe you first come across it here and have seen as an option to maybe help you with your back pain. Now, I did say we're giving away one of these tables to one lucky winner, and to enter couldn't be more easy. All you need to do is like this video on Facebook, share it to your profile, and tag 2 friends to be entered into the competition. We will announce the winner 1 week after this video is published, and there'll be full details on how you can enter in the description underneath this video. So check it out if you want a little bit more information to make sure you're entered into this great giveaway. Thanks so much for watching, and good luck. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.